So as Dr. Jefferson is getting our slide deck ready, good afternoon and good evening, everyone. My name is Bobby Mann. I'm the Maddie's Human Animal Support Services Pilot Director. Along with Sarah Miller, we are here helping host this amazing webinar today, the third part of our external facing medical care toolkits, which is utilizing existing veterinary care. And so today we have an amazing group of folks that are going to be talking you through the toolkit and giving you all the tools and resources you need in order to be successful. So Dr. J, as soon as you're ready, we can get this kicked off. One last housekeeping. We are absolutely encouraging you, use the Q&A function if you have questions. We are going to have discussion topics for our speakers, so we are going to do a deeper dive than just the slides. But if you have questions, please put them in the Q&A. We will be answering them live because we feel like this hour is going to be so busy, there may not be time at the end. So without further ado, I'm going to toss it over to you, Dr. Jefferson.
Great. Thanks so much for being here tonight. We are really excited to be presenting to you. It's an amazing group of people that came together to help build the toolkit for utilizing existing private practices to offer access to care to prevent owner surrenders for medical reasons. So the outline of our presentation today is just covering the why of this group, briefly going over our guiding principles as a working group for the HOS project. We will talk about a model that offers care through existing practices that's shelter-based, one that's crowdsourced based, and then go through some funding options on how to find money for this, and then looking at practices that actually offer this, and also a third-party model. And then lastly, talking about a case study of coalition building to get this work done that's happening right now as a result of all this work. So the why of this is looking at all the intake records for the pilot organizations of the HOS project. We were able to determine that there's over 200 reasons for intake, which is a problem all in and of itself. But the bigger words on this are the ones that are the most prominent in the reasons why animals are coming into shelters to begin with. And you can see that right up here, health of animal is very prominent. And so what that means to us is that people either animals are coming in because their owners can't afford care or they can't deal with the health of that animal, or they're coming in as strays with a health problem and maybe aren't being reunited or picked up by their owners because of the health of the animal. And so that is an extremely important thing for us to be focused on if we're trying to prevent unnecessary intake into shelters and keep pets with their families.
So one of the first steps our working group did was to collectively define the guiding principles we wanted to base our work on. This conveys the values and the culture of what we believe access to care ideally entails. And so some of the things we were guided by were the thought that all animals deserve access to medical care, that the client and the patient-centered care was important, that we wanted to make sure we took care of both ends of the leash. We wanted to make sure that we're safeguarding life and quality of life issues, that all animals deserve our best efforts at a humane outcome, regardless of their circumstances. We wanted to make sure that we're creating partnerships because all of this works better when we work together. We also wanted to make sure that we're not going to harm the shelter staff and the operations within the shelters with any of these programs. And then finally, we wanted to make sure that we stayed within the legal statutes and the professional guidelines, and that if we found things that we wanted to change, that we would work hard to engage in changing them.
I'm going to share a little bit about what types of services we're currently providing here at San Diego Humane Society that might be something that can be repeated at other locations as well. One thing we're doing utilizing our existing team is something that we've called Mobile Mondays. And what that is a mobile vet services. We already have a mobile unit that has really just been sitting here for quite some time. And so we thought, what better way to maybe start up some form of community vet services, then taking that mobile unit out. We opted to do it on Mondays because that's the day that we're closed to the public. And so what we do is we pull a very small medical team from our shelter medical staff, and we go out in the community and provide various preventive care services, including vet exams, vaccines, microchips. And occasionally we will work with other organizations and set up these mobile Mondays in a partnership, sometimes even in a One Health model, so that we can help the human healthcare side and the animal healthcare side. We also offer spay-neuter vouchers that helps cover the costs for spay-neuter for dogs and cats in San Diego County. And what we do is we partner with veterinary hospitals throughout the county, and they can sign on to our contract and agree for a specified fee to provide that service, and then we will reimburse for that service. Another thing that we offer are veterinary vouchers, and this is really to help people be able to provide veterinary care that maybe otherwise would not, because they're financially insecure, they might be experiencing homelessness or other issues. And so our team manages this kind of on a case management approach. And again, they partner with veterinary clinics, and what we will do is help provide a portion of that cost. And then usually the guest pays another portion of that cost. We're also piloting right now transportation assistance programs. So piloting it with Uber and a few other organizations across the country to help get these pet owners who don't have reliable transportation to their vet clinic, or maybe to the pet pantry to get food and pet supplies, to a spay-neuter appointment, to our vaccine clinics that we hold at each of our shelter locations, and also to come into the shelter to adopt or reclaim an animal. And we're hoping to expand that as we go through our trial period. We also offer flea medications, non-prescription flea medications at no cost to people that reach out to us who need that for their animals who might be experiencing flea infestations. And then we do also offer vouchers to cover the cost of prescription food if there is a guest that needs assistance and has a prescription for their vet. So we will send that to their veterinarian to help cover the costs. The final thing is our care program, and this is really how we can provide assistance to people that are relinquishing their pets for usually urgent medical conditions. And at this time, we don't have a stationary veterinary hospital. So this program works by them relinquishing the animal to us. Our medical teams here in the shelters provide that care. So a common reason is a fractured leg. So we'll repair that. We will track our costs, and then we will have a conversation with them and see, if they want to take that animal back and if they can pay part or all of that cost. And then if that animal is not spayed or neutered, we'll make sure that that happens before they're returned as well. Okay, next slide. And just to give an idea of the volume that we're working with now, and I know that this past year doesn't really seem to count as a real year, but I wanted to share a little bit about the numbers. In this past fiscal year, and our fiscal year goes July to July, we've issued 465 vet vouchers and 410 spay-neuter vouchers. And the spay-neuter voucher program is a new program for us. We just rolled that out this past July, and we are currently partnering with 8 veterinary hospitals. We do get an enormous request. We get about 50 to 80 per week for our teams for spay-neuter services and veterinary services. So there's a lot of need out there, and our team stays pretty busy trying to follow up on each and every one of those requests. Pet families impacted by our community pet events, the number's not that high, but we did have to pause our events for several months due to COVID, and now we're going to start back up by providing those monthly again. And then our care program, which we're also working at revamping so that it's more inclusive and more objective. So I suspect that number will go up this next year as well. But this year so far, we've helped out 22 families with that.
And the program that is built around crowdsourcing is at Austin Pets Alive, and it's our Positive Alternatives to Shelter Surrender program. And it was created to help prevent intake. As we were trying to work on Austin becoming a no-kill city, we recognized that there was a lot of animals coming in that maybe didn't have to, and we didn't have nearly as much information as we have today. But this program was set up to help intervene. And the way that we set it up is by building a volunteer base to do all the work. And we eventually added a staff person. And even over the last few months, we've added a second staff person. But starting by building the team job descriptions, creating ways to accept funds, it's all social based. So it's on Facebook, but we do utilize phone and email in order to receive requests to be posted on the Facebook page. So in order to get this off the ground, you have to have your volunteer team job descriptions, a way to accept money, which we use. We have people actually call in to veterinary hospitals and pay directly so that money's hopefully not going to the owner and just going straight to the veterinary hospital to care for that pet. We have to have a way to deal with last minute emergencies. That's one of the biggest problems that we see, is that there's middle of the night problems and they don't have anywhere to go. So preparing for that, having some sort of contingency plan. We have a lot of canned content for responding to, I think my dog has parvo, or things like that are emergencies, but they're common emergencies. Tracking data is a problem. It's something that desperately needs to be done, but Facebook is not a very good vehicle for that. So we have some data that we keep in spreadsheets, but we're looking for a better way to capture that is more reliable and automatic. And the Haas project is working on that as well. And then you have to have protocol. So everybody's saying the same thing and on the same page as they're instructing people what to do. And then the last thing is just building the audience so that there's enough people there to actually help each other. And so we promote the page amongst the rescuers and Austinites in general, not necessarily only people in need. We actually need a lot of people who have extra to be able to give to people in need. This is an example from the past page, the Facebook page, and this dog had eaten something and had a blockage and had gone to a surgical hospital and was quoted $4,000. And there's no way that they were going to be able to come up with that. They actually created a GoFundMe before they recognized that PASS might be able to help them. And so they reached out to us and we put it on the page, and you can kind of see the back and forth that's occurring between the different members over on the right-hand side. And all of the posts are approved through the PASS manager, so we can make sure that there's a little bit of quality control before something goes up. She also has volunteers that can do that for her. And really quickly, the $4,000 was raised. So I think it helped a lot that she said that this dog was her family's pet and really important to her family in the GoFundMe write-up. And I'm trying to think if there's anything else on here that is helpful to see, but this works really well. It took a while to be able to build up enough people. We've got about 13,000 right now, but just in the last year, it's grown by 3,000. And so it's possible to we've been doing this for 12 years, and it's possible to start small and it starts to build on itself. So people share with each other, that people that they know care about a certain type of disease or are looking for ways to help the community. They get pulled into this and then they become fans of the page, and then they're kind of waiting until the next one shows up so that they can help.
All right, that's my cue. So I'm so excited about this part of the presentation because there are so many bright minds on this call that we have to pick. So we're going to take 5 every few minutes during this presentation and ask a question to our amazing panelists. So I'm going to pick on Zara and say, how do you control costs when the work is done in private hospitals?
Sure. So I can answer, at least for when it comes to our spay and neuter vouchers, we've set the fee of what we're going to pay for that service. And that includes the surgery and e-collar and pain meds. And then the veterinary hospitals sign on to agree to that fee, so that, and they know, and the guest knows, that anything beyond those services would be on the guest to pay. So that's kind of how we create it, is we've got it laid out. We have a contract. when it comes to other vouchers, we're only able to provide a portion. So for example, for a veterinary voucher, we're really only able to provide about $200 per case just because of the case need. And so really then we're not necessarily able to control what that private hospital is charging, but we do have relationships with several different hospitals. And to the best extent that we can, we try to work with them and work with that hospital to make sure that they can get the care that they need. But that can be a tricky thing.
Yeah, well, I love that. Working on building trust and relationships and moving that relationship forward. So, Michael, Dr. Blackwell, I'm going to call on you for this same question as well.
Sure. In our work, we are building more structure and predictability in how we work with the private veterinary hospitals. And with respect to fees, what we've been testing out is starting with their own fee schedule and asking for a set discount. We've been testing it at 20%. And that way the practices can do financial planning and understand what the costs are to them. And of course, for anybody supporting that patient financially, will come to understand that the costs are at least being controlled.
That's such a great point. You know, if you're able to figure out what those hard costs are, they can really forecast on how to be sustainable themselves. Thank you, Dr. Blackwell. And Jeremy.
Yeah, so in Los Angeles, we're kind of like Zara in San Diego. We've found that it works best if we have very clear expectations with the veterinary hospitals. So we have, you know, written contracts that we provide them that spells out pretty clearly what we will and we will not pay for. And so it's generally for our spay neuters, it works fine. With the emergencies at night works a little bit less fine because the emergency hospitals sometimes take liberties. But for the most part, I think if you're clear with the expectations and the hospitals want to work with you and you have a good relationship with them, I think it's generally not a problem in controlling the costs for most of the cases.
Seems like we got a trend out there about relationships, transparency, and creating up sustainable practices. So Jeremy, I believe you are our next slide, so you can keep on rolling with it.
Yep. So basically what our working group wanted to do is come up with a letter, because really the first step in all of this is getting in touch for the shelters to get in touch with private practices and try to form the partnerships and collaborations that we really feel are so important in getting any of this work done. And so we came up with a letter. This part of that you can see on the screen right now, this is just the first paragraph basically of our 2-page letter. And it's a letter you get in the toolkit. And it's basically just trying to get the conversation started with the veterinary hospitals about trying to work with the shelters to provide access to care for pet owners whose only other choice is to surrender their pets. And so the letters can be emailed, it can be regular mailed. You can do a webinar with your local veterinary hospitals, and however you want to use it to get the veterinary hospitals buy-in is what we want you to do. And it can be, you can change the letter as much as you want to make it fit your needs, but it's just basically a starting point to get the conversation going.
So I'm going to briefly highlight another resource that's available in our toolkit that focuses on outreach to the veterinary clinics in your community. And as Jeremy mentioned, the first step is always important to establish a dialogue with veterinary clinics as the first step in developing those relationships and partnerships to work on access to care. But once those communication channels are opened, it's a good time to talk about some specifics. And this resource, which is in the toolkit along with the letter, highlights some of the ways that veterinary clinics can help provide access to care to their clients in need. And it was developed with some ideas from veterinarians with the Humane Society Veterinary Medical Association on ways they were successfully able to expand access to care. And now most veterinary clinics are already offering one or more of these options, but it's also good to be mindful that most veterinary clinics cannot offer them all, but this is just to give them some ideas, so something you can share with them to start them thinking about other options. And just to quickly highlight some of these ideas, the option about offering payment plans, which is relatively new concept for many veterinary clinics, but those can be set up in-house and or work with an outside provider. And one of the options mentioned here is vet billing. There's also crowdfunding, crowdsourcing, and we've already talked a little bit about that through the PASS program, but there are crowdfunding options such as waggle.org, where they'll collect the funds and then distribute them directly to the veterinary clinic. So that's something that clinics can share that information with their clients. Pet insurance is another option now. Many families cannot afford pet insurance, but for some who can, that is a way to help with veterinary costs, particularly emergency needs. Telemedicine, that's something that we've seen become much more popular in the wake of the pandemic, and that is a way to offer more affordable and accessible veterinary care. There are also foundations that are available to veterinary clinics where the foundations can accept the donations and then in turn provide funding to the clinics to help with their clients in need. And those two options listed there are national foundations, but there are also are foundations that are set up at the state level for veterinary clinics. And then finally, clinics can maintain and share with clients a list of resources of nonprofit groups that help, that specifically focus on helping with veterinary medical bills. And again, those are nonprofit groups that are local, state, and also national groups available as well. And just as a reminder, this tip sheet and the letter that Jeremy discussed are available in the toolkit on the Haas website. And I think now we're going to go to another roundtable.
Yeah, it looks like those resources were also just put into the chat for any of the folks that need them, but we'll move on to discussion topic number 2. How do you set up private vets to want to do this and keep wanting to do this? So I'm going to ask Amy.
Yes, well, I have an interesting perspective because I have been on the nonprofit side for most of my career, but now I actually own 2 private practices. So I see it from the other side as well. And I think one of the biggest things is don't ask vets just to do everything for free. They're being asked by so many different people all the time. So try to do something that's mutually beneficial. So a great way to start out is by starting a medical fund that you can use with the practice. So when they get clients or when you're referring clients, that you're giving some money to go into that to help with that cost. That is a great way to start out a partnership that can really build a relationship. The other thing is make sure you're paying your bills on time. A lot of times we'll see that groups are not paying and you can rack up $10,000 and private practices just can't afford to have that. So I think that's a really important thing to have. And I think the other thing is also have one contact that's kind of the main person that they can go to and talk to, so they're not talking to every foster, every person within the organization. And then lastly, I think is try to be there for them as well. So for instance, if they call when they have a litter of kittens that are dropped off, or they have an animal that they're talking about euthanizing that they don't think needs to be euthanized and they need some help, be there for them on that. So the more that you go back and forth and build that relationship, the better it is, and give them opportunities to come to see your organization. So let them come see what you do, because I am amazed how many private practices have no idea what's going on at their local shelter. And when they go down and see, they're blown away with what's accomplished and they want to be a part of it.
It's a big part of changing perception and building relationships, right, Amy?
Yes, definitely.
Perfect. Pam, we'll come to you for the same question.
Yeah, and I'm going to follow to some of the comments Amy made. In terms of establishing those relationships, sometimes what is really helpful is the veterinary professional or the veterinarian to talk to a veterinarian. So if the shelter or the animal control agency has a veterinarian working in the clinic that can reach out to the veterinary provider, the private practice, and establish that relationship and talk at that professional level and really get to know each other. And as Amy suggested, even invite each other to visit and see what's, what the other world is like. also just to go into these relationships not expecting veterinarians, private practices to be able to do everything, especially when you think about now, many veterinary clinics are so overwhelmed. It's a stressful environment, and to just be cognizant of that they can't do everything. And also, finally, I think it's always important to remember that good old-fashioned thank yous are really helpful. So to acknowledge what they're doing, to thank them, handwritten notes even, or just to give them small gifts of appreciation goes a long way.
And food, wouldn't you say, Pam? I think all the vets on this call would agree. You feed veterinary staffs and you keep them happy forever.
Exactly.
This sounds like a solid game plan so far. Abby, I'm going to come to you to round out this question.
Yeah, thanks, Bobby. I think I have two key takeaways here. I think one is sharing with private practitioners this national crisis of access to care. I'm still finding a lot of veterinarians in our state that aren't aware of how many people really need care that can't get it. So helping them understand that in a really kind, friendly way, I think is really important. And then I also think in our conversation, sharing with veterinary personnel the benefits that these types of programs or strategies can have in their hospital. Veterinarians are humans too, believe it or not, and they work in this field because they want to help pets. And this is a really critical opportunity for them to make a difference for the families that need it the most. So having resources to provide care for all animals can really help prevent compassion fatigue and that emotional turmoil that can go on within veterinary teams that comes with turning people away that can't afford care. And so I think that could be a really strong selling point for veterinarians, that they can help people and reach clients that they've never reached in the past by using some of these strategies, whether it's direct partnership with shelters or some of these other crowdsourcing options or any of the really great tools that Pam just mentioned on her toolkit.
Yeah, I love it, Abby. I think the foundation of the reason people do this work is because they want to help pets, right? And so as we work together, we can allow everyone to do that. And I believe, Abby, you should have the next slide.
Perfect. Yeah. So right in line with what Pam was just mentioning there in her last bullet point on her slide, in addition or in conjunction to using existing veterinary practices, another thing that your organization might want to explore is using other existing nonprofit organizations that provide financial assistance to pet guardians for medical care expenses. Look for organizations that allow pet guardians to go to their local veterinary hospital for care and then grant funds to help support those costs. These orgs might be other shelters or rescues in your area. It could be private 501c3s that are focusing specifically on just assisting with medical expenses for pets. Also, we know there's some national organizations working in this space as well. So if you compile a list of organizations, this could be really useful to you if your org is building or growing an internal program to support pet parents. And you may in the beginning find that the need for financial support exceeds the capacity of your program. And so some of these other orgs could be used to sort of supplement that and meet that need or fill that gap that you may not be able to fill right off the bat. I would recommend looking locally. Believe it or not, we have several of these orgs in our state, and you may too, and you may not even know that they're out there because they may not be associated with a brick and mortar, with a shelter or rescue. I think the local orgs give you a little bit of a competitive advantage because they don't get as many applications as some of the national orgs do that are working in this space. But go ahead and put everybody local and national on your list. And when you've got a list, make a document that you can easily distribute to families when a crisis happens. So this is an example document made by the coalition in the state of Missouri that is posted all over Facebook groups where pets are in crisis and families can't afford the care that they need. And it just makes it a really, really easy response. Nobody's typing emails. We're just throwing this document out there, and it takes that burden off of your staff. The other thing you might think about adding to this document is sort of a facts section. You can't see it here, but page 2 gets some frequently asked questions, because what we found is that pet guardians were thinking, oh, well, they could never cover this, or they wouldn't help me because I don't have good credit, or all of these reasons they thought they wouldn't qualify. And so we answered that right off the bat. So just to summarize, a reminder, we want to use our existing veterinary practices to help preserve pets with their families, but there may be other NPOs that can help you in this work as well. And you might as well engage all of those resources that you have in your network.
All right. And as this topic is trending and the more that we're looking and supporting our communities, the more that we see and find the need. So Dr. Blackwell, I'm going to come to you to talk about which owners are eligible to use funds.
Yes, in the Aligned Care healthcare system, we enroll only means tested public assistance program families, meaning they have demonstrated need that's been documented. This is strategically important because to ask veterinarians to discount fees and to maybe make certain other sacrifices, we find that they're more willing to help when they know that those sacrifices are actually going to the people intended to receive that help. And so we think that this is an important criteria to use. And of course, we know there's a debate in our industry about whether means testing should happen. We happen to believe that that would be important. This is also true for the donors, though. For those who are contributing funds to support families in need, there needs to be due diligence to ensure that the family that was intended to receive that help gets that help.
Zara, we'd like to come to you and hear about how you're handling this in San Diego.
Sure. So I guess I'll give the other side of that. So we, as far as our spay neuter vouchers go, we are not doing any sort of requiring any sort of proof or asking anybody for any kind of documentation. There are a couple of reasons for that. One being just the staffing capacity to be able to do that with the volume of requests that we receive every week. And then on the other side, it was just the potential concerns that we didn't want to create barriers. And we just figured if somebody wants to get their animal spayed and neutered, we're going to help them do it. You know, when it comes to our other vouchers, we don't as well, but we also work through those more from a case management approach. So I feel like a majority or all of those cases really do need the help. We're working, you know, our team spends a lot of time talking with those guests. And I can share too, from my experience running a clinic in Los Angeles, an affordable care clinic in Los Angeles, that we did not as well. And a lot of that just had to do with the fact that we didn't have the capacity to do that. And we didn't want to prevent people who maybe can't show any documentation. We didn't want to prevent them from getting any care, but I definitely understand both sides of it, and I don't know the right answer. So, but that's what we're doing currently.
Well, Amy, I'm going to come to you as the bridge that's lived in both worlds. If you want to hit on the pros and cons of each approach or even share another, we'd be happy to hear from you.
Yeah, we also do not screen, but we're also lucky we're an Aligned Care partner. So we have Aligned Care there for us, which really is very helpful for us as a tool. And I think there's room for all of these tools. And so we don't, and the reason we don't is because we believe that finances are fluid. And we see a lot of times where people move from into poverty and out of poverty, depending on their situation. And a lot of times it's not just based on their income, if they just had a health issue or just lost their job or just facing some other issue. So what we like to do is we use care credit or scratch pay as kind of our determiner. So if they get turned down from that, then we have a variety of options. And that's what I'm going to talk about in a few minutes of what those options are. So Aligned Care is one of those, vet billing is one of those, and some others. So I think just the important thing is not just to offer one thing, but to have a lot of options to meet people where they're at.
Well, nothing more I like than someone being able to intro their own next slide. So Amy, I think you can take it right from there.
Okay, great. Well, yeah, so I started 2 private practices with some business partners, and we set out to answer one question: is can you have a full service private practice that makes a net positive revenue, but also doesn't turn people away and helps people? And so that was really what we wanted to see. Could we do that? And then could we share that out in the field? Because those seem so mutually exclusive sometimes. So I'm excited to say we have been able to do that. We've been able to make we fluctuate sometimes between 18 to 20% net profit that we're making. So now we've started a nonprofit called Open Door Veterinary Collective, which is going to share with people how to do this. So this model is for private practices or for nonprofits to be able to do. And so it really focuses on 5 key principles. And the biggest one is the payment support options. So we want to normalize the financial conversation up front and take away that stigma. So when people first call in, when we're on the phone, when it's on our paperwork, when we're in the exam rooms, on our website, we have different signage up. We have the conversation right away so that people are not being forced to wait until the end and then realize they don't have any money. We're right away having that conversation, because 1 in 4 people had a barrier to care in the last 2 years, and that number is growing. So we need to start offering more payment options because, again, as I mentioned, finances can be fluid, and the majority of people can afford to pay over time. They just can't cover that unexpected large expense at once. So there's actually research that shows that 1 in 3 households are financially fragile and couldn't come up with $2,000 within 30 days if they had to. So imagine if your dog's hit by a car, you may normally be able to pay, you just can't come up with it that fast. So if a client comes into us and indicates that they need help, we first will have them apply for care credit or scratch pay. And if they're declined, then we offer other options, because nationwide, only 40% of people are approved for care credit. And a lot of times it's not through anything that they have their bad credit risk. Many it's because their credit invisible, or they don't have credit built up. They've always rented. They haven't applied for anything yet. So at that point, we offer vet billing. And that's our in-house payment plan. And a lot of clinics are afraid to offer payment plans because they've been burned. But vet billing actually has a 95% repayment rate. And we get to decide who gets the plan, for how long, for how much, but vet billing takes the work out of it by setting it up and gathering all of the money and doing collections. They also have other things we use, including wellness plans, pay in advance plans, and pre-savings plans, which I'm happy to talk to people about. But if somebody still isn't eligible, maybe they don't have a bank account, so they still don't qualify for vet billing, which a lot of our people will do. Then we have a payment support tree, and we go down that. Our team is trained to go through all the options until we find ones that work. So we'll do a lot of those ones that Pam talked about. We'll be using Waggle, we'll be using crowdfunding, we'll be using nonprofits. We have all sorts of things. And then we also have a Stay Together fund, and we give $1 back from every healthy pet exam that we do into this fund. And then our medical team can use that for clients when it's a life-threatening surgery that they need. And it gives our staff the power, which is also really nice. So a good example of why this is so important is there's a dog named Bosco, and he shattered his leg. His regular vet was estimated to be $3,000 to repair it, but his mom didn't have the money. So she contacted a nonprofit clinic that was using vet billing. They quoted roughly the same amount, but they allowed her to put half down and then make payments over months. So now she was able to get the care for her pet, and the clinic got paid. And that's really what we're trying to do, is get the clinic paid and get that pet the care and keep that pet and people together. Another big piece of what we do is incremental care. And that doesn't mean less than the gold standard. A lot of people worry that that's what it means. What it really means is it's a step-by-step approach to meet the client where they're at. So a good example is we had a cat named Baloo who came in and who also had a shattered leg. That's the really big one to get into when you're getting into those types of cases. And the owner could not afford the surgical repair, which was offered. They couldn't afford the amputation. So we did decide to start to splint the leg and give pain medications, making sure that Baloo at no time was never in pain. This gave the client time to gather additional money so that then if we did need to do an amputation and get radiographs, they could do that. So we actually were able to splint. He actually made a full recovery on his own. We were able to confirm that with radiographs a short while later, and that allowed us to provide that still good quality of care, and Baloo is doing great today. So we have a variety of situations where incremental care can be used and have good success, and that's something we share with groups that want to do our model and how they can do it. And those of you who work in shelter med, you've been doing this for years. It's a lot of what you already do, but it's something that we're really trying to get into the vet practice. The third piece that we do is the budgeting piece. And that is a really, really big piece of what we do too, is we work with individual clinics to go over what your goals are. And then we create a spreadsheet where we really look daily, weekly, and monthly with you to really look at the schedule, look at your no-shows, look at the revenue. And that is a really big piece to make sure that you can make money, and then you can help the people who can't afford any care. So the people who really need that care, who can't even pay over a couple of months, you've got an option. We actually have done this for 2 clinics so far, and they both lost money the year before, and within 3 months, we were able to get them to actually start making money doing this and still be able to increase access to care. The fourth piece we do is operational efficiencies. We use our veterinary technicians to the fullest level of their skills. And that's something that's really important to them because that's what they went to school for. They want to use those skills. So we let them use their skills. We also have limited inventory on site, and we script out a lot, and we use online pharmacy and offer lower pricing in general. So like our exam fee is $38, where the average is $58 in our community. And then lastly, we do partnerships. A lot of times still private practices see nonprofits as taking on more vet care as a threat. And we know nonprofits can't meet this demand alone. There's 29,000 private practices. We've got to leverage which each of us does well. So a great example is the medical fund. In Asheville, our Humane Society is a great partner. They give out vouchers for $150, and we can refer people to them. They can refer to us. We can do a lot of medicine for $150. That is a huge piece of what we do. And then we also partner with human healthcare. We actually work with a local hospital that does an emotional support animal program for people diagnosed with depression. We work with our housing authority, and we go in and provide vet care. And then we also work with social workers. We have social work interns come in to our clinic, and then they actually put together pet resources to share and to do grief support, help with euthanasia. So there are so many ways that we can partner. And when we do these partnerships, it opens up a lot of funding beyond the traditional animal welfare resources that we don't normally think of. So a great way for shelters and nonprofits to partner with private practices, offer that medical fund, help train the vet staff on determining when something truly is cruelty and when it's just an access to care issue that somebody could be helped with and worked through. Help take in pets when there is a euthanasia situation where they don't want to euthanize because the pet is healthy and an owner wants to do that and the staff doesn't want to, when they get the kittens dropped off. So that's really important. And I had a lot more to say on slide 2, but of course, as usual, I went over. So I'm actually just going to say that if you are interested in learning more about how you can implement any of these pieces into your programs, I'm going to put my contact information in the chat, and I'm happy to do that because our goal is to teach people how to do a net positive revenue anywhere from 10 to 30% and really build up these partnerships, because we believe that it's the most humane thing to do. It's humane for the clients and for their pets, but it's also humane for our staff so that we don't have to turn people away. Vets did not get into this field to have to turn people away, and it really, really hurts them when they have to, and this gives them options so they don't have to.
Hey, Amy, we actually have a couple minutes. We're running a little fast. So if you did want to do another 60-second hit on this slide, we'd welcome it.
You're going to be sorry you told me that. Okay. Yes. Yeah, no, I'd love to. So I think that, you know, what's really, really important is that when we offer these options and we have tools, we're opening it up for everybody. And I think that that's really the biggest thing here, is that a lot of times clinics get into a vicious cycle where when people can't afford to pay and they've been burned by giving discounts or by giving payment plans before, then they have to say no, and everybody walks away feeling bad. So this is a great place where the nonprofit can really play a role in helping that private practice. And it really does work so well. When we work with Asheville Humane, one of the things we find is they have a very robust outreach program. So they have the hotline, they get a lot of the calls. They partner with the clinics in town. They will call us, they give the voucher, but because they're going out, they're identifying the clients. And what we're finding is that when they go out and identify these clients, a lot of times you think, oh, we hear vet clinics say we don't want those clients. We don't want the ones who can't afford to pay. We're already so busy. But $150 is a lot, and that's just what they're paying. A lot of times the clients can pay more. And on top of that, they're seeking, Asheville Humane found that 49% of the people that they are helping through their Pets for Life program and through their outreach actually go on to seek vet care for other pets. So I think that that's a really important thing, is vet clinics, a message you can give them when you're trying to get them to partner with you and offer some of these tools is that this is bringing in additional clients. This is bringing in additional money that we would be leaving on the table otherwise. And I think a really great piece of this too is Align Care. And I think that Dr. Blackwell is going to be speaking next. And that's something that's been a great thing for our community as well.
Okay, we are all aware of the problem of lack of access to veterinary care. I do want to emphasize that there is a spectrum of care needs, from wellness preventive care to sick injury care and critical emergency care. As we looked around this country and in doing our study, we found that the biggest gap existed at the time of sick or injury care. So in other words, when we looked at every community or looked into communities, we saw programs like have been shared here today, where shelters, nonprofits are really doing a great job of addressing the wellness and preventive care end of the spectrum. However, many of those organizations were not in a position to treat a sick or injured case. And when we looked at options for getting support, if it involved a grant, that meant some waiting time, sometimes into days, yet the problem needed immediate attention. And so for us, that meant developing a structured way to have predictability so that we could tap into the largest resource in this country for providing sick injury care, and that's private veterinary medicine. It's where most of the knowledge exists, the capability, the equipment, and so forth. Rather than replacing existing services or competing with existing services, Align Care was intended to fill that gap and therefore complement, existing services. Our value proposition, therefore, is to work hard to mobilize our communities in new ways, engage veterinary social work as a primary way of supporting families, facilitating these veterinary service providers. In other words, I mentioned earlier about their ability to predict what it's going to cost them to treat a case, the 20% discount. But because of our veterinary social work, they are getting assistance with those clients in special ways, especially like for communication and so forth. And of course, we wanted to complement the animal shelters or nonprofits in the community who might provide wellness preventive care, but had an option for the sick injury care. Of course, we needed to develop an IT system that would enable us to tie it all together. Next slide, please. This is a high-level overview of Align Care, and what we basically do is identify veterinary practices in a community that are willing to partner with us, along with animal welfare organizations, a shelter. Part of our work is organizing the community around what we call a community advisory council. It's made up of a diverse members of or stakeholders, especially to address the funding side of this, because Align Care is a subsidized healthcare system. The families that are enrolled are means tested, as I mentioned earlier, because the people who are not able to get the help for sick injury care don't have finance options or pet health insurance options. If they get financing, it's often predatory. If they have to apply for a grant, there may be a delay in getting help. We're training human support coordinators in all of the communities that we're in order to facilitate these families reaching resources that may not be veterinary care, it may be food, housing issues that they also are faced with, but also helping with the communication with the between the family and the veterinary service provider where needed. And again, our IT system allows communication amongst all of the stakeholders, as well as the, I shouldn't say stakeholders, the partners, the families, the veterinary service providers, human support coordinators, and of course ourselves. Again, a complementary system that's structured, because here's where we want to end up. We want to appeal to funding that does not traditionally show up in animal welfare. That means ultimately government programs that support families are going to factor in non-human family members. And I think we can get there. We need the human health insurance industry to see that they have a role here as a unified healthcare system. And so that's what Align Care is intended to do, is provide that structure with predictability. Good planning can go into that. Through time, the families that will be enrolled will go beyond where we are today, but we started where the gap is most severe, and that's with those with quite limited means.
So basically putting it together in kind of just quickly with Los Angeles, what we've been trying to do is figure out a way to help pet owners who are in need keep their pets out of the shelter. And so, I can't remember who said, I think it was Amy who was talking about there being different levels, different resources. And that's really what we're trying to do. So, the first step in this is just identifying the key stakeholders in the community who can kind of form the group. And so that there's community intervention groups. South LA has a group called Downtown Dog Rescue, who's been around for years. They do great work. So, the head of that group is part of our coalition. You want to find motivated veterinarians in the community. I mean, there's I think been a change in the private practice world about how they view access to care. And so I think there's a lot more veterinarians who are willing to, who want to help. And so, finding those vets and getting them on the coalition helps as well. Having shelter staff who are really into this idea is something that's been a big help as well, because if you don't have the shelter staff's buy-in, then it's really difficult to get the shelter to move ahead with anything. And then you definitely need the fundraiser part of it. So, again, in LA, we have the Annenberg Group, which is a private group that's doing animal welfare, and they've got a lot of donors and they've got a lot of tie-ins to donors, and so we're using them as well. And then I'll just put in a little pitch for Align Care. We are starting that. We've already started the beginning stages of that with Dr. Blackwell, and so the hope is that that Align Care in Los Angeles will be part of the solution. And then, I'll put another plug in for your local VMA. I know, in the country, there's some VMAs I've heard that aren't as effective as others. I will say for Southern California, the VMA with Dr. Peter Weinstein has been fabulous. He's always willing to help and get the word out to all the member veterinary hospitals to try to get them involved. But we want to start out small. You only need 1 or 2 vet hospitals to start. And then collaboration is key. But I think for municipal shelters as well, as I've been finding out this past year, there's a lot of red tape. There's a lot of rules that you have to follow in terms of using public money for private owners has been a big problem. And so getting through that has been a real challenge, but it's doable. You just got to keep at it. So, I think the real goal is to have as many different options as you can for each individual pet owner, because not everyone fits one thing. So trying to have some different options when somebody shows up at the shelter is the key, I think, to keeping them out of the shelter.
All right, this hour is just flying by. And Jeremy, thank you so much for talking about your pilot. And as we are early adopters and innovators in this project, even just the value of doing this work is important to us. But in order to sustain it, we have to prove the value of it. And typically that's done through data. So Jeremy, do you want to start and just tell us how you're measuring your impacts towards your goals?
Yeah, this is a really hard one, because I don't think there's I don't think anybody has anything that everybody can use. And so, I think for the shelter referred pet owners, I think that's pretty much all we can really do at this point. So when somebody shows up at the shelter wanting to surrender or is looking for help and we're able to help them, then that's something that we can track and we can keep records on. But it's really difficult right now for us if somebody shows up at a vet hospital and wants help, it's hard at this point, unless you have really good communication with the particular vet hospital. It's really hard to know when that's happening. So I think we need to figure out a better way where everybody's talking with each other, so that we do know, kind of as we go through this, how many people we're actually helping.
Thank you. Dr. Jefferson, I'll pose the same question to you if you want to talk about what is possible or maybe what's not possible yet.
Yeah, it is. I'll echo Jeremy on that, that it is really difficult to figure this out. And I think starting at the shelter level and just at least keeping track of the number of people that are being given assistance through the shelter or through connections for the shelter, and then the outcomes of those animals is a really great place to start. We know that the shelter industry is only one piece of the puzzle of where unclaimed or separated animals go. And part of those animals, a big chunk of those animals, go into veterinary hospitals and maybe are rehomed through the veterinary hospital or even euthanized because of economic reasons. And so we have an opportunity to work together. And I think that that's the beauty of the Los Angeles Coalition, is that the everybody coming together, you can actually start talking about mutual data and how that's important to help each other with the goal of trying to prevent unnecessary euthanasia and unnecessary separation, which is everybody's burden. The other thing that I think would help is around the idea of just the community being more aware of resources, which is a double-edged sword, because if everybody knows and they don't quite understand how it works, or there's no guardrails around it, then there's, who wouldn't use the system. But the more people know about the options that exist in the world, the more likely they are to help themselves and figure out how to prevent their own separation. And I think one of the big goals of Haas is to prevent us from being the gatekeepers of knowledge, prevent us as the animal welfare industry being the gatekeepers of knowledge that anybody can use to help them solve problems instead of all the problems coming to the shelter. So I think that there's a lot of work to be done in terms of that mutual data collection and transparency and the community understanding, and just sort of becoming sort of the common knowledge that it is possible to get care for your animal if you can't afford it through regular veterinary means. So I don't have a great solution at the moment, but I think that that's the whole point of, that's one of the points of the Haas project, is to try to start figuring these things out, especially around data collection, because it is our Achilles heel in the shelter industry. We don't know enough about what is happening across the country and even internationally. And so we have an opportunity to try to get a lot better in a short period of time so that we can make better programmatic changes moving forward.
Yeah, I love that. I think you're right. It is a mutual conversation between not only partnerships with external stakeholders, but also our partnerships with our community. And I think that is ultimately the goal of Haas. And Zara, I'll come to you for the same question.
Sure. So I'm kind of coming at this question from more of from a data perspective. And one thing I think that probably a lot of organizations struggle with is making sure that we're collecting the right data so that we know if we're having an impact or not. And one thing we've definitely found here is that if, the data that we pull out of our shelter software is only as good as the data that we're putting in. So if we're not collecting the right thing, or maybe we're not collecting it in the right way, we may not get the information that we want. So for example, relinquishment reasons, I think one thing we've had here is we've got a few different options when somebody relinquishes an animal as far as medical conditions, but even trying to make that more specific so we can really see what are the needs of this community and why are animals coming into us, for example, and making sure that the data we're collecting regarding the services we're providing are actually going to help tell us something and tell us if we are making an impact. But I agree, it is really difficult because the shelter is only one piece of that puzzle. So I think that's something that will continue to evolve as we keep figuring out solutions within our communities to helping more people.
Thank you, Zara. And I think what's inspiring to me is that there's already so many people coming to the table to have the conversation. And I think that's the beauty of this project, is it's about bringing people together to solve these longstanding industry problems. So this hour has gone by so quickly. I cannot thank all of our speakers enough. Dr. Jefferson, I would love to toss it over to you. I know you're been leading this working group, so if you have any final thoughts for us.
Sure. I just want to mention that the toolkits are amazing that this working group has put together. What we presented today, not all of that is in the toolkit, but we'll be adding as we go over the course of the working group's lifetime, not people's lifetime, but the working group lifetime. And the other thing that I would just keep in mind, if you're wondering why this is important and it's not convincing enough already, is thinking about all the resources we put into medical care for the animals that come into our system. And if we can prevent some of that work being on our shelter, then that's more care that we can provide. We can provide a better quality of care for the animals that do come into the shelter. And so it is extremely important for all shelters to be thinking about how they can keep animals out, especially the ones that have owners that love them and they just have this problem accessing care. And then the last thing I would say as a close is just to keep in mind there's so many ways you can get started with access to care and external facing medical care, and it can be very hands-on or not very hands-on at all, but that you can start anywhere and just get the ball rolling to start helping people now.
Well, thank you all so much, panelists, for being here. Thank you, viewers, for being here. A reminder, you will have this recording at the beginning of next week, and we look forward to seeing you on future webinars. Everyone have a great evening.